and welcome into To Your Health. And of course, this is February. February is Heart Month, and we've been discussing the heart all month long. And of course, we want to do is maintain a healthy heart and find out some things that can cause you a problem. Today we have with us Stormy Forrester, and Stormy, you are the nurse manager at the cardiac unit at Baptist South.
Correct.
Got it all in without any problems. I want to ask you a question right off, because we hear about the fact that the word congestive heart failure, and it's kind of like, ooh, does that mean that we need to bring in the undertaker at that point? What is actually happening when you're talking about congestive heart failure? People live with it for a while, don't they?
Correct. It can be well managed with the right education, healthy cardiac diet, medication regimen is prescribed by your physician, and exercise within your tolerance. With those things, you can manage congestive heart failure and still live a healthy, quality-filled life. The important thing is getting that education out to your patients and self-educating as much as possible to have the best outcome. When
you say congestive, it always sounds like I'm at this intersection, it's real congested. Is that what's actually happening inside?
Right, so I'll give you a quick explanation, real layman, so that everyone can understand. Your heart is a pump, and it pumps your blood to circulate and provide your body with oxygen. When you have congestive heart failure, part of that pump is failing, and so it's not pumping effectively. And what happens as a result is you have a buildup or congestion of fluid in your body that can back into your lungs or into your periphery, or your legs and arms. So you can see increased swelling there. You can have shortness of breath and a hacking dry cough. Those are all warning signs of potential heart failure.
And what our objective is to uncongest this, right?
Right. As I mentioned earlier.
It can be, this is one that we can reverse it a little bit, because a lot of times you have a disease, you say, well, I've got that forever.
Not so much reverse, but manage it.
Okay.
So you have the best outcome, and you're at your healthiest when you have a combination of that prescribed medication regimen, heart-healthy diet, and activity and exercise. So that gives you the optimum benefit and outcome, but you're always going to have that. It's just how you manage it to have the best quality of life.
Interesting.
Yeah, one thing I would like to share with our audience, you've received some pretty nice awards over there in the cardiac section at Baptist South.
We have
Would you just tell us a little bit about that? Because you got to feel secure about where you're going to be treated.
Well, at Baptist, we put our patients at the center of care. So we really stress meeting the guidelines of American Heart Association, what are best practices and gold standards. We implement that in our care, and we use that to educate our patients for when they go home to take care of themselves.
Well, I just know it's been acclaimed, and there have been a lot of awards, and I think it's wonderful to know that right here we've got a great place to go. I would also like to ask you, women, let's cover one thing here. Men and women present differently with heart attacks or strokes. Could you tell us a little bit about that?
Sure. Men typically have the textbook symptoms. They have a crushing chest pain or crushing in their chest, pressure. They can have pain that starts in their jaw, or numbness that radiates down their left side. For women, sadly enough, they can just have shortness of breath or just feeling off or nausea. So it's really important to pay attention to your body and what feels right to you. And if something's off, to go get checked out. Check up with your physician yearly is important, but also if you have shortness of breath, if you have things that your body's telling you to go get checked out, because for women it's not as pronounced. And they can see more problems with heart attack treated later than sooner because of the symptoms are so minute.
Yeah, guys need to get hit in the head before they realize something's wrong. We're ladies kind of feared, I'm okay.
Yeah, we're sneakier.
Yeah.
But and one thing I'd like to emphasize, if you're feeling like that, don't go out and get in the car and drive yourself.
Right.
If you've
Yeah.
got those symptoms, don't do that. So, you know, there's some common sense things that we overlook sometimes. But again, if you could name the top 3 things to do to prevent having a heart problem, what would they be?
Okay, exercise, healthy diet, low in sodium, low in fat. You really want to be careful. Sometimes the quickest, easiest foods are cans or processed foods or TV dinners that you microwave. Those are all high in sodium. So you want to get a diet that's about 2,000 milligrams of sodium or less in your daily average. And ways to do that is eating more fresh vegetables and fruits, and or the frozen ones that you can steam. Those have
Right.
less sodium,
Okay.
they're more nutritious. Those are ways, just having a healthy exercise regimen, getting anywhere from 10 to 30 minutes cardiac activity a day, keeping your heart rate up. Yes.
A day, huh?
Thank you so much for being with us, because our goal really for our audience is to hopefully
healthy
teach them
lifestyles.
things that will prevent them having to come see you, as sweet as you are.
That's right.
We want to help you stay healthy, and thanks for being with us, and we'll be
And you
right
get the
back.
award for a beautiful smile.
Oh, thanks
We'll
for
put
having
that in
me.
with all your others, Stormy. Thank you so much.
Take care.
Absolutely. We'll be right back right after this.